Okay? So, guess I can put this over here, out of the way. Okay. Pages. All right. Okay, are we on or?
Brief announcement.
Oh,
I'll
please.
just say a couple of sentences.
Right ahead.
Assalamu alaikum. The sister side, we have the wireless mic available. So if any of the sisters have any question from the speaker, they can definitely ask.
Please. Yes. Okay. Good evening. Where are we at? Got everybody situated? Okay. First of all, I'd like to thank the congregation for inviting me here. This is the fifth mosque I've been to in the last 3 years. This is purely an informational presentation. If you have questions, please ask. There is no such thing as a stupid question. There's a lot of stupid answers, but no stupid questions. So what I'm going to talk about tonight is what you need to know about health care reform. It's been in business now since 2010 when it was signed into law. The first enrollment was held in 2013 for the 2014 year. We are now finishing up on the third enrollment. Hello? There we go. Back up a little bit. What you need to know, what is it? The marketplace is just that. It's a place you go to buy something, to make a choice. And you're given a choice through an online marketplace. And that online marketplace allows you to shop for different health plans. And depending on your financial status, your status as a citizen or resident of the U.S., you can qualify. There are two different types of marketplaces. One is called the public marketplace. This is held by the government and by the state, and these are accessible over the internet. Now, if you do not have internet access, there are paper applications. So don't think you're cut out because you don't have internet. The other side of it is what they call a private exchange that various companies run for their benefit. They're a little bit quicker than healthcare.gov, but they interface with the government as far as checking for your subsidy, which is what your income will get you, depending on what you make, and they will actually enroll you. Now, this is where it can get a little complicated. With few exceptions, all U.S. citizens and legal residents are eligible for the marketplace, or for Obamacare, or for the exchange. It goes by many different names, and that's what's caused a lot of confusion. But it's basically a way for you, so we get here. If you're a lawful resident, you may purchase the health plan. So if you have a green card, you have a visa, student visa, asylum visa, you've got your citizenship papers, whatever. If you're a legal resident of the United States, you can purchase health coverage. There's also what they call tax credits. This is your subsidy. This is based on your combined, if you have a joint income, if you and your spouse work, or if you're the only one working, it is based on a joint return. So if you are married, you have to file a joint return. If you're single, that's fine too. Individuals have access to employer health care. If you've got insurance at your place of work, you cannot go to the healthcare exchange unless it is what they call unaffordable, or it is not a qualified health plan. Now, by unaffordable, what it means is that your premium, as an employee only, not as a family premium, employee only premium is greater than 9.5% of your income. That's where it gets a little tricky. People say, well, if I buy family plan, it's going to cost me a bunch of money. Well, they don't take that into account. They only look at what you pay for yourself. Now, that does not exclude your family from going to the marketplace and getting coverage. It just means that you won't be included in the subsidy calculation. And it gets a little complex, but you have to go through an insurance agent to really get some of this stuff straightened out. And the thing with the marketplace, the health insurance agents that can sell on the marketplace have to be certified and registered with CMS. So just any health agent may not be able to help you on the marketplace. They can help you outside the marketplace or off market. But if you go on market, you have to have a registered and certified agent to help you. And the last 2 points is not considered affordable if it exceeds 9.5, or it doesn't provide what they consider 60% of covered expenses. The plan you have has to be able to cover at least 60%. And that's what you'll hear the term coinsurance of 90-10, 80-20, 70-30, 60-40. 60-40 is the lowest level plan available. If your employer does not provide a plan that covers at least 60% of your expenses, it's basically not a qualified health plan. Then you can go on to the marketplace. And the subsidies help offset out-of-pocket expenses. Basically what a subsidy is based on your income. They will come back and say the government will pay X dollars towards your premium. What that does is if you have a premium of $300 and you have a $100 subsidy, you will pay $200. Depending on your income, you can pay as little as nothing for a health plan. But you have to be very careful and make sure you select the right one. Early on, the first time around, people were taking a zero premium, thinking they had a great health plan. The problem was they had a $6,000 deductible, which we'll get into later, which meant they still had to pay for everything until the deductible was paid. So yes, it was cheap until they got sick. Then once they got sick, they had to pay out of pocket until they paid the first $6,000. So it wasn't all that great. Here are the plans as they're set up. They come in 4 metallic versions. As the metal gets more priceless, so goes the plan. A bronze plan, very cheap metal, very cheap plan. Silver, it's a little more expensive. You know, your girlfriend may like silver, but she probably likes gold or platinum. Well, gold or platinum are the expensive plans. They also cover more. If you go to a gold plan, you're basically at an 80-20 coinsurance, meaning the carrier will cover 80% after your deductible is paid. Platinum plan, I've only seen 2 in the last 3 years. And for a couple, it'll run about $3,600 a month. And if you're paying that much for a medical plan, you might as well just pay out of your own pocket, because that's just too expensive. Low-end consumers, like to say, may be eligible for subsidies to assist in your premium expenses. Okay, essential benefits. One of the things that you'll hear is a qualified health plan. In order for a plan to be qualified, it has to cover all of these items. Prior to the Affordable Care Act, Obamacare, or whatever you want to call it, an individual plan did not have to cover maternity. It did not have to cover mental services. It did not have to provide a preventive care visit to the doctor. So now every plan that you have out there has all of these items. If it misses one of these items, it's not considered qualified, which means you're open for a penalty. That's the other thing with the Affordable Care Act. If you don't have health coverage, you'll be penalized. And the penalties have gotten greater as they've gone along. The first year it was $95 for an individual. A family could be charged up to 3 times for that $95. The second year it was $325. This year it's $695. Children count half, so it's you, your spouse, and 2 kids make up 3 charges. The preventive care. Every plan, whether it be bronze or platinum, has to provide you a preventive care visit. What this is your annual checkup. How many in here go in for an annual checkup? If you're like most men, you don't. Okay? With this, what they are trying to do is get you to set a baseline. How well are you? Do you have anything wrong with you? Do you need care? You should go for an annual checkup. I was a little lax in that until I was about 45. I've been for an annual checkup since then. It doesn't hurt. They may draw blood, but they will find out what might be wrong. I had one gentleman found out he was hypoglycemic and needed insulin. He was also had high blood pressure. He had high cholesterol. He wasn't feeling great. He got himself on a plan, went to a doctor. The doctor took care of all of his needs, put him on medication, put him on a diet, put him on an exercise program. He's feeling fine now. His blood pressure is normal, his cholesterol is normal, and he's got his sugar controlled through the doctor's instructions. Flu shots, pneumonia shots, prenatal visits, well woman care, regular baby checks until they're 21. So there are things that are scheduled from the time they're born until they're 21. There are certain shots, certain visits they have to make to the doctor. Okay, the good part about this is it is guaranteed issue. There are no pre-existing conditions. If you are diabetic, if you are COPD, you have severe asthma, you have a physical condition that needs to be taken care of, you have a bad back, that doesn't count. When you apply for your health plan, they do not look at that. They can't, they're not allowed. The only thing they can look at is if you smoke. If you smoke, it's going to cost you money, anywhere from 30 to 40% more in premium. So if you smoke, don't. If you're thinking of starting, don't. I lost a younger brother to lung cancer because he smoked for 51 years. He was diagnosed in May and died in October. It is not a nice thing. They can't charge you, they can't exclude that condition from the plan, and they cannot overcharge you for it. It used to be when you signed up for health insurance, you're diabetic, oh, we don't cover that. Oh, I've got severe, oh, we don't cover that either. We'll cover everything else, but we won't cover that. Okay? Or if they did cover it, I just jacked up your price. Instead of paying $400, you're going to pay $800. They can't do that anymore. Okay. This is where they have the penalty. This is where it is right now. Okay. If you do not have a qualified health plan, and they get this penalty basically assessed at income tax time. This is not a monthly penalty. This is not something they'll come after you at now. They'll wait until you file your taxes for 2016, which is 2017. If you don't have any coverage, you'll get penalized with this, which is $695 per person, up to 3 people per family, or $2,085. It will come out of your tax return. They will not send you a bill. They can't garnish your wages. They can't put a lien on your house or your business. They take it out of your tax return. That probably will not last much longer because it has no teeth. You know, I don't have a tax return. What are you going to do to me? I can't do anything. I can't take it out of your tax return because you don't have one. Now, if you have a big tax return, yeah, they'll take all of it. But for right now, that's what you're faced with as a penalty. A lot of people have decided, I don't need the marketplace plans. And in some cases, you can find cheaper plans because you don't need much coverage. I've had people look at it from the standpoint of getting an indemnity plan. If I go in a hospital, they'll pay me $5,000. That should be enough. Save the cost of this, so it covers the penalty, and I still make money. You have to make the choice. I'm not going to sit here and say everybody in this room has got to buy this. You may not want to. It may be cheaper and more to your benefit because you're healthy not to have a marketplace plan. But like everything else, that's why they call it insurance. It's a risk. If you're willing to take the risk and not be covered, you'll have to pay the penalty, but you also won't have to pay the premium. So you may save enough money to cover this and still put money in your pocket. It's all up to you as to how you want to do it. And like I tell people, this has forced people to start thinking about how they budget their money. You just can't automatically think, well, I won't pay it or I will pay it. Maybe it's something I need to do, something I don't need to do. You need to physically sit down and think about what you're paying, where your money is going, and you have to be responsible for your own money. I can't say up here and say, well, you should have a bronze plan. You should have a gold plan. Because you look like you have a lot of money. He's got a lot of kids. Well, premium should be lower for him. You have to take it one case at a time. You have to take it on yourself. Find yourself a good agent. I know there's some here in the congregation. Talk to them. Find out what's going on. The only bad part right now, you got until the end of January. Then open enrollment closes. Once it closes, you do not have access to a plan with no pre-existing conditions. I cannot sell you major medical after January 1st. If you came to me on February 1st and said, I need a health plan, you would have to have what they call a special enrollment period. That is triggered by somebody getting born, somebody dying, somebody getting married, divorced, moving in country, losing coverage at work. There's 9 or 10 different items, but you have to have one of those situations. And even with them, you get 60 days, and that's it. So if you don't have a special enrollment period reason, I can't talk to you until next year. And I can't get you covered until January of next year. And you're going to pay a penalty. So take a look at it. I think that's about it. These are some of the terms that I wanted to cover. Is there any term up there that anybody wants an explanation for? I can go through these one at a time. The first one's the deductible. That's simple. If you get a plan and it says it has a $3,000 deductible, what that means is for lab services, hospital services, or anything like that, you're going to pay the first $3,000. And until you pay that $3,000, the carrier probably won't pay much of anything. After that, you get into what they call the max out-of-pocket. You'll see this term, max OOP. Max out-of-pocket is your deductible and then a charge after that. So you may have a $3,000 deductible with a $6,000 max out-of-pocket. What that would mean is if you paid your $3,000 deductible, you get into $3,000 of coinsurance. So the next $3,000 would be paid out at your coinsurance rate, which is 60-40, 70-30, 80-20, or 90-10. The big number is what the carrier would pay. The small number is what you would pay. That small number is added up until you reach that $3,000. So you've paid a $3,000 deductible. You've paid up to $3,000 out of pocket at your coinsurance. So you've paid the $6,000 total. So you're now 100% covered. And this is where it drives people a little crazy with the coinsurance because it's different than a copay. A copay, if you go in for a doctor's visit, if your plan is set up, you have a copay. Copay could be anywhere from $20 to $50. That's a charge you just pay the doctor for. You do not pay the full charge. A normal doctor visit nowadays runs anywhere from $75 to $120. Your copay is your $20, the carrier covers the rest of it. It only covers the doctor's visit. Any services, lab services done after, doctor wants blood drawn, that goes against your deductible. So depending on where you are with your deductible and your out-of-pocket, you may pay the full price or you may pay 70-30. So a $100 charge, you'll pay 30, the carrier will pay 70. In and out of network, this is getting very strange. Blue Cross dropped their PPO network. They only do HMOs. The problem with that is a lot of doctors that were on Blue Cross PPOs don't take HMOs. That's the other thing you have to be very careful with. Is your doctor in network for the particular carrier and plan that you're on? So if you have a doctor here, find out what plans he does take. What carriers does he take? Blue Cross, Aetna, United Health, Cigna, Humana, Scott & White. Find out what plans they take. That will allow you to figure out what plans you should be getting. Because if the doctor's not on the plan, he is out of network. Out of network means you pay full price. There are very few plans now that have both in and out of network. You'll see them if you look through the prices, or the plans, They say they're an EPO. Well, that's different than a PPO, and the EPO does not cover out of network. They only do in network. So your specialist, your primary care physician, all have to be in network to be covered properly. Specialist or primary care physician, this is the person you would go to for an annual physical. This is usually a general practitioner. He may or may not specialize in anything. The specialist, this is your ear, nose, and throat, podiatrist, so forth, a heart specialist, cardiologist. These are all specialists. Most plans will require a referral from your primary care physician. This guy here has to recommend this guy. They both have to be in network in order for you to get coverage. Hopefully I haven't caused too much confusion with all the information. Are there any questions? Sir?
The deductible go towards, the copay go towards satisfying?
The copay does not go to the deductible. It's basically you're paying the doctor. Okay, it's not charged out. Now on your primary preventive care visit each year, you don't pay a copay, you don't pay a deductible. You don't pay for the lab services. That's why I say every plan allows you one visit a year at no cost. So everybody should be using it for themselves, their spouse, the kids, whatever. Now, this is my private exchange, the Jade Insurance, ACAexpress.com. It's basically another way of enrolling. Mine is a little bit quicker than healthcare.gov. You can use either one. The healthcare.gov right here is the federal site. It's been up since 2014. Mine interfaces with them on a much simpler platform in the front end. Questions? I'm fast and furious. Yes, sir.
Is that penalty is going to be more higher than it is now? Every year is going to go up more?
That is what we've been told. What I've heard so far is 2016, it's $695. 2017 is going to be $975. And again, it's 3 times in a family. If you're single, it's only once. Now, you can make too little to qualify for Obamacare. And I've had this happen in Arlington. I had a gentleman, his family and his income put him in a position where he did not qualify for Medicaid and he did not qualify for Obamacare. So he was basically in this little black hole with nothing. Well, we were able to get him into John Peter Smith. They have a community program called JPS Connect, but you have to prove you got denied Medicaid and you have to prove that you got denied Obamacare. I was able to get him the document for that. He already had his denial letter, put them together, walked in and got covered. It's not full coverage, but it is coverage. They do have the same thing in Dallas County. They may have something up in Collin County that does the same thing. So, that's it, gentlemen. Sir. Okay.
2 questions.
Okay.
So I do have coverage from my work,
Yes.
but I want to understand. So if someone has, let's say, very low income, and you show silver, bronze, and gold and platinum, and let's say he chooses to go for platinum, right?
Okay.
He has no, let's say, almost zero income or minimum income, right? Can he go for that?
If you have no income, okay, you don't qualify for Obamacare. You actually have to make an income.
Okay, let's say you make very low income.
Right now, for a single
So Obamacare doesn't cover people who have no income?
no,
That's crazy.
that's Medicaid.
Are they paralyzed?
No. That's the other thing. If you don't make enough money or your income is low enough, you will not get penalized. You have to make enough money to get penalized. It's sort of like if you're a good worker making a lot of money, they're going to penalize you if you don't have it.
Okay, so let's say you make low money.
Mm-hmm.
Can you choose any?
You can get any one of these based on your subsidy. Okay. Now, for an individual, it starts off at about $12,000 a year. So if you're an individual, you have to make at least $12,000, probably a little bit more. And if you make less than $47,000 in that price range, you qualify for a subsidy. The less you make, the bigger your subsidy.
Right. So let's say someone makes 12,000 a year, for example.
Mm-hmm.
Why would he not choose platinum? Why would he go for silver?
I'm sorry, I missed it.
If someone makes 12,000 per year, for example,
Mm-hmm.
he can choose platinum.
The premium is high. That's the thing.
If he wants it,
But
I'll put it this way. If you're making $12,000 a year, you're going to get a good subsidy.
Yeah.
Okay? At the bronze level, you will probably pay nothing. But you also not get much coverage.
So catch here is this. Okay, so let's say platinum you need $400 per month.
Mm-hmm.
For example, right? 100, 200, 300, 400.
Right.
You get, let's say, good subsidy. So you pay $100 only as
At the
a
bronze level.
cross level, right? And you're getting 400 coverage, right?
Mm-hmm.
But on the top of that, there's out of pocket.
Yes.
But that's not good actually for poor people.
That's why I said you need to be very careful when you select a plan. Okay? Just because it has a zero premium doesn't mean it's the absolute best for you. You can get into a silver plan, and back on, let me see if I can get back. What they use here, what they call their benchmark, if you buy into a silver plan and you have a good subsidy, what they're also going to do is they're going to reduce your deductible and they're going to reduce your out-of-pocket. I have seen people get a $2,500 deductible plan for $250 because of their subsidy and their income. If you're at a certain level, they'll reduce your costs even further. Everything is based on your situation and where you stand income-wise. So that's why I can't go to everybody here and say, I know what everybody in here is going to get. Because you're different, you're different, you're different, they're different, you know, so.
Second question, last question, sir.
Oh, okay, then I'm finished,
Quick one. So you mentioned that if husband has your joint family, husband has a coverage from the work, 9.6% something, right?
right?
But family can go to the Obamacare.
Yes. Basically what that does is when you enroll all, say you have 2 children, your spouse and yourself. You've got employer coverage. So you would go in and enroll, naming all 4 people, but you would not ask for coverage, just your wife and the 2 children.
But they will check your income against.
Your income, yes, it still has to be your income.
And you will not qualify.
And no, you may qualify, but you'll qualify for a smaller subsidy because you're getting a subsidy at work. Because your boss has to pay part of your premium. Okay? So they can't count you as part of the subsidy calculation, but they can count your wife and 2 children.
And if you have coverage for your family for the work, you cannot go there.
If you got coverage for your wife at work and you want to continue to pay for it, that's fine. Again, this is where you have to sit down and figure out, do I want to keep doing that? Or can I come over here to Obamacare and say, I'm going to put my wife and kids over here and just pay the employee only? Because there's some employers that will pay the full price for employee only. So it's a calculation every time you turn around, and you have to pay attention to your situation. And we had one here.
My elderly mother, she is not able to work. She has never worked. I'm taking care of her for all her medical needs. 2 years ago, I started paying penalties because I don't have insurance for her. But and applied for Medicaid also was
Right.
denied because of reasons that I don't know, because she's never worked in this country. She's a resident.
Okay.
So my question to you is, it seems like very unjust for the people who are not able to work, they are not able to get Medicaid. How does this Obamacare can help them?
Basically, what he's saying is his mother hasn't worked, needs medical coverage. He's been denied Medicaid coverage, maybe because of residency. How long has she been here?
10 years, she's a permanent resident.
Okay. Have you tried Medicare?
Yes,
How
I tried both of them, and the reason they gave is that she does not have enough quarters in her income tax.
Right. You have to have 40 quarters to get Medicare.
Right.
But you should be able
I'm not asking the Medicaid or these people
Right.
to give me insurance, but I just don't want her to be penalized. See, my
See, and that's she was penalized by
last year when I filed the taxes, she was penalized $400 and some odd dollars for 2014 income tax with no income.
with no income.
Yeah.
I talked to your CPA because he may have not calculated that part. Because if she has no income, was she? I could see it possibly being a penalty to you. Did you follow her?
Yeah, I filed her for dependency.
But did you have coverage?
Yes, I did have coverage for my work. I don't need.
Oh, okay.
So I.
That's where you got caught.
So do you know, or do you, in your knowledge, do you know if this program can help? I can take your assistance or services for such reason.
That would be a little, it's going to be complex because of her situation. I can't imagine, what's her age?
79 this December.
Okay, so she's like my mother-in-law, she's up in years. That would be the other alternative, but then if she's not a dependent for him, he really can't get any benefit tax-wise that he's helping his mother at home. So it's one of those things, you're caught between a rock and a hard place, and I don't know whether I can get you out from under the rock. Normally, you should be able to get her some kind of Medicaid or Medicare, but you're going to have to pay full price, which is about $400 a month or more. Per month. Okay. That may be cheaper than what you're going through now.
So it would be advisable for me to pay $695 as a penalty because I'm not using it.
Right. Right.
So, and then why pay $400 a month?
Yeah.
That's what I've been doing for the last 2 years.
Yeah.
I was hoping there was some change.
Not there's still some holes in the process. Okay. There are people that are left out in the cold, so to speak. And like I said, I've got people that actually fall between the two and have no place to go. And if you're lucky to be in certain counties, they do have a county program. So, okay. Yes, sir.
You alluded earlier, there was like a 9.5% greater if, let's say, the employer provided benefit.
Okay. If your employer provided an employee-only premium of $100, okay, and your income was low enough that that $100 was actually 10 or 15% of your income on a monthly basis, that would be unaffordable. That $100 has to be less than 9.5%. So you take the $100, multiply it by 12, and then divide it by your annual income.
But also, just to go further, you mentioned that the employee, and I think that was kind of discussed earlier, but I couldn't really hear it.
Okay.
So the employee can basically elect to be part of the
Employer program, correct.
but can take the family out into the
Marketplace. He basically takes him out of you enroll everybody in the family, but you don't request coverage for yourself.
So the definition of somebody, because there's a definition of unqualified, that definition pertains only to the employer-employee relation, not extends to the family. Is that correct?
Right. The first year, I couldn't get you covered for your family.
Because the way it is worded in the exchange, it paints a broad picture which does not clarify.
Right.
This is the first time I'm hearing.
Right.
Because the way it's worded, it just basically paints the picture as the entire family.
Right. No.
Nobody can assume and really quantify what you have just said for what it is
Right.
saying in the ACA.
Basically, the way it's been done and the way I've been able to get people enrolled. And this goes for people that the spouse is on Medicare. Okay? They don't qualify to be on the marketplace, but they need to be included in the subsidy calculation. So you basically enroll both people. When it asks who needs coverage, you mark yourself and you take your spouse out. The same thing for husband, wife, and children. The husband's covered at work, he does not need coverage. Wife, 2 children do, so you mark those 2. It'll redo the calculation of the subsidy based on 3 people versus 4, because the husband's getting a subsidy at work because the employer pays for part of it.
As far as the tax certification is concerned, you said there's no preempted bill coming out. It's just
No.
if you have returned, they take off, right?
Yes. Right now it's that way. It's that way now. They may change that, It's the government,
Yeah, I mean, just
Yeah.
a very last question.
Yeah. No, that's fine.
Just a hypothetical. Let's say there's a family. Definition of household, I don't want to ask a dumb question, but it pertains because ACA has many dumb implications.
There are, yes.
Cannot understand. So, having said that, when you talk about the household itself, do members have to be physically part of your environment, or they can be, because ACA extends till age 26, is that correct?
Correct.
Okay, so having
Now-
said that, obviously 26 years old, many of them are not staying within your boundaries of your house.
The way it works is if they are in your family, if they're your family, okay, up until age, when they turn 26, they've basically been thrown out of the house. Okay? They can be married, they can be in school, they can be sleeping in the basement.
So by what you just alluded, so by definition, if they are not 26 or less, even if they are not within the boundaries of your home, but they are by definition of ACA part of your household, is that correct?
Right. But you would also have to count their income as your family income. Even though, yeah, and that's where it gets really tricky. One of the closing remarks I tell people, there are 3 people you need to have telephone numbers for. One is a tax guy. If you got a small business, you need a CPA, and you need an insurance person. And you need 2 of them. You need one for home and auto, and one for your health and life. Because I haven't done my own taxes now in probably 10 or 12 years. I don't want to touch them. I don't want to go near them. I just give the information to my tax guy and say, here, you do it.
So by definition, the household definition being a constant, what we just discussed, that being said as a constant, let's say a household of 5, 2 being less than 26, but they have proof, and they can prove and quantify they have their own insurance. But by definition of household, when you apply, you can still say 5, correct? Because that's a constant.
If they have their own insurance, they've just dropped off the map. Because you got to remember, you're applying for insurance. If they already have it, they don't count. It's like the husband having employer coverage.
But the definition of household has just changed.
Not really. They're a household, but they're independent of the household for insurance. They may live with you, but they've got their own insurance. So they're in your household, they're eating your food. If they're in school, you may be able to take them as a dependent. But for this coverage, basically, they have to go here for insurance, not elsewhere. So it's kind of tied to that. It can get complex.
And do you know where there's a chart for AGI for household? Is there a chart? I didn't see in the ACA website if there's a chart for household AGI, just gross income versus the household size. Is there a chart? I really didn't see that.
They probably don't have one. I've seen several been passed around by different companies that are following the ACA, but the ACA is not going to publish anything.
That it automatically grounded into the.
They'll figure it out for you. Okay. Yes, sir.
The income level, is that before taxes or after taxes?
It's adjusted gross income. It's like, I think it's line 47, 21, and 37 on the different 1040 forms. Go this way. Okay. Oh, okay. Okay. Getting back to that, the income is based on the maximum you can make for a subsidy, anything below about $46,000. If you want to find out how much you have to make if you've got more than yourself, add 17,000 to that figure for every person that you have in the family. So it'd be 46, 62, then goes to 78, 94, and just keeps going. You can go as far as you want. If you go to the website I had up there, the first page, the first screen displayed says find a plan. You need a zip code, your age, and your estimated income, and it'll show you what kind of money is going to come out of your pocket. It'll show you what kind of subsidy you get and what the premium would be. It's very quick, very simple. If you find something there that you like, make sure you read the details. Like they say, the devil's in the details, because it'll cost you more if you don't. So, have we got anything else?
If somebody is a resident here but is not staying here the year round, this
That's, if you're considered a legal resident, that's why I said you got to read the fine print. If you're a legal resident, now I've run into several gentlemen, they go back home. One gentleman goes back to Jordan every year to get his teeth worked on. Okay, some go back for prescriptions, whatever. They'll spend 2 months there, but then they'll come back. As long as you're paying taxes in the U.S. and you're a legal resident, you should be able to apply for this. And I see no reason why you can't do that, because there are other people that, some people travel to Russia 2 months out of the year because of their business.
but the coverage will be for all 12 months.
You wouldn't be covered outside the United States. You would have to get travel insurance to cover yourself outside of the States.
So, but the premium they will charge for
Oh yeah. Yeah, you don't, just because you went out of the States for 2 months doesn't mean you don't get to pay. They'll always want their money.
So in your opinion, which company has the best bang for the buck kind of thing?
Right now, I'm upset with most of them, because they've all screwed around with the deductibles, and the networks have really gone crazy. I mean, I lost 90% of my clients on Blue Cross because they dropped the PPOs, and I only recovered a few. The other ones have gone to the EPO, which means they don't do out-of-network. Well, that causes some problems, because some people had specialists that were out-of-network, used to be covered at 50-50. Now they're not covered at all. So
all plans are
again, you have to look at it for yourself, find out what your doctor takes, ask him which ones he prefers. Some doctors prefer certain carriers. They say, well, I'll do Blue Cross and I'll do Aetna, but I won't do Humana, Cigna, and United Health. They all have their preferences.
What about hospitalization?
That boils down to what hospitals are around and what the hospitals take. Most hospitals will take most insurances, but you have to be careful there also. So, if you're healthy, this is not a big deal. If you've got medical conditions or you're accident prone, you've got kids that are in soccer that keep coming home with a busted leg, you might want to do a little more research. The problem, not the problem, but the situation right now, used to be, people used to come to me and say, give me the cheapest insurance you got. So I gave them the cheapest insurance. They never looked at the plan, didn't question it, just said, okay, fine, I want the cheapest thing you got. That's not the best way to do it now. You've got to know what's going on. And the government has forced people into having insurance, and in some cases that's not a good deal, because there's a lot of people out there, especially young people under 35, they haven't been sick a day in their life. They haven't seen a doctor since they were born. Why should I buy health insurance? I'm going to live forever. And that's their attitude. And it's slowly changing, but not in the right directions in some cases.
And all of these also have prescription drug coverage? Or?
Yes, that's required. They have to have drug coverage. But again, it depends on what kind of drugs you're on. Okay? You're looking at, now they're up to 5 tiers. There's a tier 1, 2, 3, 4, and 5. 1 is generic. 2 is what they call non-preferred generic. Still a generic, so the first 2 are relatively cheap. You get into the brand name at tier 3, you get into a formulary where they basically compound it for you, and then you get into tier 5, which is the specialty, experimental treatments, whatever. Most people can get generics for most situations, not everyone. And that's what's recommended if you can tolerate generics. That's things that people have to also understand. Just because it's generic doesn't necessarily mean it's the best one for you. There are some of the drugs for anxiety, psychotic drugs that are time released in the brand name. The generic is compounded as you get all of it up front. So you're happy for the first hour of the day and then you're depressed for the rest of the day. So you have to be able to take the generic and be able to tolerate it. So, anything else, gentlemen? Sir?
What is the licensed agent and non-licensed agents?
Okay, I'm what they call a Group 1 licensed agent. Okay, I actually have a license from the state of Texas. I've been tested. I have to have my training. I have to take 30 equivalent hours of training every 2 years. For the marketplace, I have to be registered and certified with CMS, and that's the Center for Medicaid, Medicare Services. Okay? It's the same thing as a Medicaid or Medicare agent. I don't sell Medicare, but I do sell on market. Now, I can sell off market, which means there's no subsidy. I can't help you with anything, but I can sell you straight from the carrier. But I can also do on market. So I can do both sides of the fence. And
Registered with CMS.
I'm sorry?
You have to be registered with CMS.
Yes. Now, if your agent is not registered with CMS, he is not supposed to be allowed, and he really can't sell on here because they require his CMS ID in order to sell it to you. There's a.
They have ID for.
It's not an ID. I've got my number. I've got a national producer number that's registered with the marketplace. So if I work with you, you put my number in, I'm your agent, and they can track it back to me. If I put a number in there and I'm not registered, they will probably yank my license because you're not supposed to sell on the marketplace. So, sir.
For the lawful permanent resident?
Yes.
I want to clarify one more time. Is the visitor status qualifies for this a person who has come to U.S. on a visitor visa for maybe 6 months?
A 6-month visa, I'm not sure. Okay, if it's a work visa, a 2-year work visa, a student visa, I had one gentleman that was on an asylum visa, that would probably qualify as a legal resident. Now, coming over for 6 months to get health insurance, one, it would be a waste of your money because they charge you for the 12 months.
Yeah, but any situation you can,
Yeah.
You can sort of get the full benefit.
I would call the 800 number. Let me see if I can get to it real quick. This number right here, give them a call, explain the situation you're in, and if they say yes, you can get it, go for it. But again, you have until the 31st of this month. After the 31st, you can't go to the marketplace anymore.
And you said it's only 60, after you become there's a change in status, like somebody comes here as a legal resident. They have only 60 days, right?
Right. That's what they call a special enrollment period. Okay, if you come here and you get your citizenship or your visa starts, that's a special enrollment period. You should be able to get signed up. And again, like you said, you got 60 days, and that's it.
So one of the questions, you mentioned that the person has to have filed, taxes.
Yes.
And so what about folks who are old and, they're retired and they don't plan to work, or they haven't worked in the last 3-4 years?
Depends on their age. If they're under 65, they should be able to get this, but they still need to file their taxes because that's where they do the calculations of the subsidy. Because you're saying, I made this much money, so I should get this much subsidy. Well, when the government comes around and says, okay, how much money did you make? Well, I made this much. Well, you shouldn't have got that subsidy, but I made this much. Well, we'll give you some money back. So they compare it at tax time. That's where the reconciliation comes in, is at tax time. Okay? Yes?
Let's say I can get my insurance from my
Employer.
No, here's the question. Let's say they do offer insurance for my family, right?
Okay.
For my spouse and for my children.
They always do.
Way too high, the premium.
Correct.
Now, in this situation, can I deny that? I said, no, I'm not going
You would take yourself, yours only, but when you go to the marketplace, you enroll, okay? You, your spouse, and your children, but you say, I don't need coverage, so you uncheck coverage required.
But once I go there, there is a place that say, can they also get can they get the benefit from your employer or somewhere else? And if I take that, then it says no, they cannot get the benefit from marketplace.
Usually, I tell people don't worry about that because one, most places an employee-only premium is usually next to nothing, is very low. Okay? But I want to add my wife and children on. Okay, fine. You need to pay us another $900. Well, that would bankrupt you in some cases. But if you go here, like if you go into my site, my private exchange site, okay, you would put in your age, your wife's age, and the children's age. And next to it, it says, do you need coverage? You either check the box or don't check it. Well, it comes up checked. So you would uncheck yourself. Put in your income. And again, this is estimated income for 2016, not last year. And then hit the go button. It'll come back and tell you what subsidy you would get.
Thank you very much. Good round of questions. We have one sister here and
Yes.
some questions from sister.
Yes, ma'am.
My mother is 72 years old. She
Yeah.
lives with me.
Mm-hmm.
She's on green card. She's not a citizen yet. She has 1 year left on
Okay.
her citizenship. What are her options?
Medicaid being one.
But Medicaid, she will only become eligible when she becomes a citizen, right?
Right, more than likely, okay? And Medicare is the only other option. And,
Medicare also requires 5 years of
right.
citizenship clause. And then right now we are in this.
You're in a little
Yeah.
spot where you can't do anything.
If something happens this year, I'll be really stuck.
Yeah. And I wish I could say something is
So
out there.
Marketplace has no options for her?
No.
Okay.
May I just stop for a second?
Yes.
Can he be on their tax return? And
She can. You can get. She can. If she can be as a dependent.
as a dependent,
But she wouldn't be covered under here because of her residency and probably her age, because they would probably tell you to go to Medicaid or Medicare for coverage.
I went to Medicare office. They just turned a survey saying that she has 1 year left
Yeah.
to become a citizen.
That's where you get caught. Yeah. I wish there was, like I said before, there are people out there that make too much for Medicaid and not enough for Obamacare, and they got nothing to go to. The other thing you might want to check, John Peter Smith Hospital in Tarrant County has a program called JPS Connect. It's for people that can't get Medicaid and they can't get Obamacare. Your mother might fit into something like that at the county hospital. It would be some coverage, may not be all-encompassing, but it may be enough that if she needs medication, she needs to see a doctor, needs an x-ray or something like that. I would check at the county hospital, ask information, do you have anything for people that are, they can't get Medicaid, they can't get Medicare, and they can't get Obamacare? Do you have anything at the hospital we can sign up for? It's usually a minimal premium. At JPS, I think it's like $35 to $50 a month for the family, but then there's a $5 office visit, $25 x-ray. So it would be something that would be a little less expensive than going full price.
You said John Pierce Hospital
But that's over in Tarrant County. That would be a drive.
in Tarrant County?
That's in Fort Worth.
They will take people from Collin County?
I don't know. You'd have to check with the hospital. They may be specific to the county. If you're not a county resident, they really can't get you in that program.
Yeah, that's what Parkland does. That if you're
Parkland does another thing like that, yes. So if you're in Dallas County, you can go to Parkland. I don't know what Cullen or the other ones up here might do. But that would be someplace to check. Okay?
You don't know any hospital like Parkland Hospital or
Not in this area. I'm not really that familiar with this area. Yeah, but that would be my first guess, is to try looking at the county hospital.
But I find this strange. You're saying that she cannot get Medicare, she cannot get Medicaid, and she still cannot get Obamacare? Why not?
This is for under 65.
But if she is my dependent, I cannot.
But she's not a legal resident.
She is.
Well, she's a legal resident.
She has a green card.
She has a green card.
I have someone that I know for sure, like I'm 100, because I know, I did
Right.
it myself. She's 80 years old,
Okay.
and she is getting Obamacare. But she is part of their tax return. She's
Yeah.
different. Since she is not a citizen, she cannot get the Medicare,
Right.
but she is part of the Obamacare. I know for
Yeah.
sure. Because she has had a hard
There
time
are exceptions, and being that it's a government program,
as a dependent.
right.
So I think
You need to call the 800 number. It's 800-318-2596. Talk to them directly. That's why I said I can't. There's some questions I have no idea, because I've never run into them.
special thing, like
Yes.
you say, if you call that number, maybe they will.
Yeah, ask them, specify what your situation is. Now, is she a dependent on your tax return?
Right now, we haven't included her, but we can.
You probably will have to include her on your next tax return, okay? But I would check with the healthcare.gov people, because there's all kinds of little ins and outs on this thing that I don't think anybody knows which end is up. It's changed 3 times in 3 years, so you're on your own. Thank you. I appreciate it. Okay. No, it's
Thanks for taking the time.
no, it's people need to know. They just can't.